Good afternoon, everybody. We now have a quorum. Thank you to my committee members for being so prompt. There are lots of other meetings going on, so I appreciate you being here. Representative Jenner? You're trying to get a seat? Okay. Okay. And as you notice from your agenda, Representative Willard has pulled his bill, so we will have one bill for today, House Bill 227. I believe we have a substitute. Representative Clark, are we working off substitute LC 334022S? Okay, you're on. Representative Clark. Oh.
Dr. Maddox.
Okay. Dr. Maddox.
Dr. Maddox.
He needs his folder.
Thank you, Madam Chair. Members of the committee, I bring to you the substitutes for HB 227. You should have it at your desk. As Chairman noted, is LC 334022S. Bear with me as I bring my first bill to committee. Excited to be before you all today. This is a bill that I've become passionate about as I've discussed with some members of our audience and doctors and nurses and the National School Nursing Association. So let me present this to you. This is 2 years ago the legislature passed a bill allowing students to carry auto-injectable epinephrine, known as EpiPens, if their doctor is capable of self-administering the shot. If there was a prescription on record at school. This bill was silent, though, for children who were either too young or were deemed by the doctor not to be capable of self-administering the shot. I'd like to read Section 1, lines 15, 16, and 17. It says, nothing in this code section shall be construed to prohibit a school from receiving and storing prescription auto-injectable epinephrine on site on behalf of a student who is not able to self-administer the medication because of age or any other reason that the parent or guardian provides. Section goes on to say a written statement from a physician licensed under Chapter 34 of Title 43 detailing the name of the medication, method, amount, and time schedules by which the medication is to be taken. This bill was silent regarding children who were not old enough or deemed capable by the physician to self-administer the shot. It's been brought, as we've been researching this, it's become alarming to realize, number one, the increase of allergies in children that is ever increasing. It was interesting to point out that 100 to 300 children die per year due to anaphylactic shock. And again, if there's not a nurse on hand, which found out that a lot of there are plenty of schools that may not have a school nurse on hand that would be able to administer the shot, then the child could die within 20 minutes of the first allergic reaction. So I think that it's it's absolutely necessary to have somebody who's able to react quickly and administer the EpiPen. The other thing that I wanted to point out is not only are we dealing with food allergies, but also insect bites. It's interesting that of the 50 people who die annually due to insect stings, over half of these deaths occurred the first time the person was stung. So in other words, there may not be any warning. A parent may not be aware that their child is definitely allergic to a bee sting until the first reaction. So the child would not, under the previous bill, the child would not have a pin on them. Or again, the child could be so far gone that wouldn't be able to self-administer it. 100 to 300, as we said, die annually. Also, 20% of food allergies occur the first time in children on school premises. The bill also provides that school boards will have a policy that notifies teachers, nurses, and school administrators that they are allowed to provide this life-saving measure in emergency situations. The school board is to provide them with the information on how to recognize the symptoms of anaphylactic shock and the correct method of administering the EpiPen. I want to just point out, and we have a physician here that can help answer questions, but I want to point out that it's very simple to administer the EpiPen. This one-page sheet here outlines the correct procedures for doing that. It is, I'd like to, I'll just kind of demonstrate this myself. I inquired on the safety of epinephrine, epinephrine, and so I will demonstrate for you guys here. Now, the first I would be, the signs of severe anaphylactic shock are severe. The child would be, and I spoke with my mother-in-law about this last night, about this bill and all, and she was reminding me of my brother-in-law who went into severe anaphylactic shock. And it's something that everyone I've talked with who has seen it or witnessed it, it is something you do not want to be privy to. The child will, be gasping for air. Start turning blue and pale. And if that teacher, the intent of this, I look at my children, I have 4 children, 2 boys and 2 girls, and I think of my children being at school, with teachers, all day long, and there may not be a school nurse on hand to administer this shot. And what were to happen if that child were to, as in many cases happens on school grounds, to have their first severe allergic reaction, and if somebody was not on hand, a teacher did not have the immunity to be able to administer that shot, and that's what this bill provides, that my child could be dead. So I'm passionate and thankful to be here today. 1 child dying is too many, and again, we have 1 to 300 deaths. At this point, I would like to accept any questions from the committee. And again, I have the doctor on hand as well to answer any questions that I may not.
Okay.
We'll probably defer to him.
Before we take the first question, why don't I, since I know that Dr. Redding and Ruth Bridges and Mrs. Edwards, who are both RNs, are here, why don't you all come up and sit here in front of the mic, and we'll have you available to answer questions. Dr. Redding is an allergist. Mrs. Bridges is a school nurse, and Ms. Edwards, you're with the Georgia Association of School Nurses. Is that correct? Okay, thank you. Okay, so Representative Clark will start taking questions, and if you would like to defer to Dr. Redding or the nurses anytime, you may. Okay. Representative Chokas.
Okay, good. Thank you, Madam Chair. Representative Clark, is this your first bill? It is. Would you please demonstrate the gasping that you did earlier, and then the correct procedure for using the pen?
Are there any model scouts here that might get a role in a movie here? Yes, sir. As we were noting earlier, it's quite obvious when a child is experiencing anaphylactic shock. We actually passed out. Members of the committee have a sheet here that highlights some of the symptoms, and this is also to point out just how easy it is. And I spoke with the nurse over here earlier today, and how simple it is to educate the staff on the symptoms involving anaphylactic shock. So, in the most severe, as you asked me to point out, there you go, sir.
Thank you.
Is my hazing over? Sadly, half of the deaths occurred as a first-time reaction to a bee sting.
Okay, and this bill really cannot address those, I would assume, because of prescription laws, I guess, and there's no way we could have basically one that's stored on behalf of a student who might have their first reaction.
Yes, sir. I understand you're asking, would this bill save that child's life?
Well, no, this one says stored on behalf of a student, and I was assuming that was a prescription, because you get the parents to give a approval up front. But does this language allow for the storage of a epinephrine pen for a student who might exhibit that anaphylactic shock the first time?
Yes, sir, it does. And it allows also the teacher to be able to administer any EpiPen that she could get, maybe he or she may be able to get their hands on.
Representative Harden, school systems already are responding to this in different ways. There are some school systems across our state, and I will ask our school nurse, who are storing EpiPens. They're buying them. Others are not, but I think there is a place that says if an EpiPen was available, I think what you would have in an emergency situation on a child that has a anaphylactic shock for the first time is that you would have a teacher or an administrator hunting for another child's EpiPen to use in an emergency situation, and that is probably what they would use. Hopefully that someone in the school would have an EpiPen available that they could borrow in that time and use it. I think that's what would happen.
And Madam Chair, Jenny did speak to that this morning.
If you would like to, we'll turn it on. Okay, got it on. Yeah.
Okay, can you hear me? I'm Jeannie Edwards, and I am actually a coordinator of a school health system in Dawson County, and I've been with the school system for 21 years. We have had protocols or guidelines for stock epinephrine because a lot of students, as Representative Clark spoke to, are not diagnosed with this. According to my health demographics in my county, a large majority of our students' parents list that their children do have allergies. Some of them come to school with prescribed EpiPens. Some of the students may have their first reaction in the lunchroom or on the playground, and they have no prescription. We have a nurse in every school, and we do have stock epinephrine pens. At the beginning of every year, I do teach the staff in all of the schools, the administrators, and the teachers that have child-specific EpiPens, and the principal designates lay people that are backups for the nurses, and these are the lay people that we educate on the signs and symptoms, which again are basically very easy to recognize. And also we demonstrate to them with a practice epinephrine pen. I think Dr. Redding has one that we can share with you and even pass it around. It is something that you can, see that all you have to do is just remove the cap and inject it into the thigh. You don't even have to pull the student's pants down. You can inject it through blue jeans. It is life-saving. When you give this, you would immediately call 911. And we educate not only our staff but also our bus drivers because they have these students coming to and from school with these prescribed EpiPens. But our stock EpiPen is kept in the nurse's office.
Representative Collins, you had a question?
Thank you, Madam Chair. I'd like to be recognized for a motion at the appropriate time.
Okay, appropriate time. Representative Henson.
Thank you, Madam Chair. Could anybody address how this works in the larger school systems where there is not a nurse in every school? I know Laser Joyner back there used to represent DeKalb County or still do the school system. Is there anyone that can address that? No?
Okay.
Oh, okay, great.
Somebody coming forward? Do we have somebody that...
Okay,
I
can just speak on what nurses have told me who work in states where a similar law has been implemented, where there is an impetus to train non-nurse personnel who work in the school, because as you said, in many schools, the health worker at the school is not a licensed RN or not an LPN. It's an unlicensed assistant personnel, or they're called UAPs. But we have to train these people to give epinephrine and to recognize anaphylaxis. But in talking to the nurses who have taught the training programs, it doesn't take a huge amount of logistic work and time and money. It really takes about 30 minutes to teach it, and then every year they do a 15-minute refresher course, and they teach the sessions at school staff meetings where you have the health infirmary worker as well as teachers and principals and coaches who are there at the staff meeting. So you have a captive audience, and you teach the most important people first, which would be the coach, the health worker, who may not be a nurse, possibly the principal, and the teaching. It hasn't posed logistic problems. It would need to be definitely an RN, perhaps an LPN who did the teaching. Certainly, if a physician wanted to do the teaching, that would be okay too. But it has not been the teaching has not been an issue at all in the states that have implemented this plan. It's been very easy.
Thank you, Dr. Redding. Representative Byrd.
Yes, thank you very much. I want to direct my question to the school nurse. If your school is already implementing this, and I am going to assume that there are many other schools that are doing exactly the same thing, is it really necessary that we now mandate this from the state, that each school system can already have their own protocol? Mr. Clark, can you answer that question?
Sure.
I think the situation that falls into a lot of schools, public schools in our district my children go to, there's no school nurse, there's no one trained, there's no stock supply. In some of the areas around the city, whether you have public or private, my school, I'm a school nurse for a private school. We have a little over 800 students. We have EpiPens by prescription for specific students, but we run into problems with compliance. People don't turn them in. You may not have an EpiPen when you need it. You may not have enough. You don't always have a way to get to the medication. And I think if we had a stock supply and a protocol like they have in her schools, that would alleviate the time that it takes, because we're talking about a very quick reaction with respiratory distress, and it comes on very quickly, and it needs to be addressed immediately. And we have only a little bit of time to respond to that, and whoever is on the site will be the one responding. And if they have a supply of epinephrine, which we know is a safe thing, it's adrenaline that naturally occurs in your body, we haven't seen any cases where this has really caused harm to anyone. And I feel like we would be making schools safer for students.
So just as a follow-up, so you believe by us mandating from the state level that every school system takes on this, they have a backup for every student that may or may not have an allergy to have the EpiPen on the school property. So have you gone to any of the school systems to ask if they do not have a protocol that possibly you could do this without a law?
Representative Byrd, may I ask something? May I
Sure.
make a statement? I think one of the focus of this bill is giving immunity to that teacher to make sure that because there's a case in Chicago, and this is just a couple examples in Chicago, and a case in Oregon where they're being sued for $25 million. So I think the thing is, the intent of this is to make that for that teacher to be free, to be able to step in and not be worried of threat of lawsuit, of trying to save this child's life. And then also the fact that right now that in order for a child to carry an EpiPen, the doctor would have to say that the child was capable of self-administering the EpiPen. So this would say that for that child that may not be old enough to self-administer or may be in severe anaphylactic shock, that nurse would be free to step in. As far as the training, one thing that we tried to be very careful about in this bill is to recognize the burden that school systems already have and that teachers have already, in addition to teaching. But they're already, as I understand, as I was asking some of these questions, they're already going through a certain amount of training. So for them to have to simply to require that this, this allergic anaphylactic shock that could kill a child, unlike a lot of other health issues, that would be even type 2 diabetes that's severe, but that's just a sip of orange juice or a Snickers bar will save that child to be fine. In this case, this is severe enough that it makes sense that we would at least, in that training, that every school would be required to just pass out the symptoms to look for and how to administer that shot. And again, making sure that teacher is free to take another child's EpiPen or any EpiPen that they might can get their hands on, that they would not have that necessarily have that freedom to do right now. Okay. And I know I think we all feel the burden of lawsuits right now. This is dealing with, again, my child who's with their teachers all day long and a nurse is not on hand. I don't want anything getting in the way of that child's life being saved. So that would be my comment.
Representative Drenner.
Thank you. Just to follow up on what you just said, the burden of lawsuits. What I noticed in the bill specifically is that there's nothing in there regarding enforcement. So how do you know? We're going to pass this law. There's no enforcement provision in here. So can't the school system be sued anyway because we have a law that has no enforcement provisions? It seems that we've set the precedent for a lawsuit here.
Let's refer that one to legal counsel. Betsy?
Yeah, I'm sorry. Can you repeat that? I was talking to them.
Representative Drenner.
What I was asking about, Betsy, is that the representative just mentioned the burden of lawsuits, and my question is that if there's no enforcement provision in here that says that school systems actually have to do this, aren't we actually opening the door for more lawsuits?
I don't see that at all. Basically it's just authorizing the school. The school is not going to be required to, the teacher doesn't have to administer the EpiPen. It's just saying that the school board has to allow them to if they want to and if there's one available. So I'm not really seeing how that would invite more lawsuits. I think I might be missing your question there.
Right. Okay, let me try it again then. If we're saying that we're doing this to prevent potential lawsuits, right? Because isn't that what he just got through saying, was that you have lawsuits that are pending in other states because they did not have access to these pens? Didn't you just say that?
Thank you. I understand what you're saying. What I was trying to communicate is that in addressing your question, we tried to make sure that there's not a mandatory requirement on the schools to provide training. Simply that they're required to let their teachers know that they are free to administer, that they have, I guess, the permission to administer the EpiPen to a child who is in anaphylactic shock. That they're aware that they have that right to step in and save the child's life when a nurse is not present.
I'm still a little concerned that this is not going to help us in the case of children who have that first time anaphylactic shock from some allergic reaction. Because the law requires that you have on file a written statement about the parent and guardian for the release. Well, by the time you get a written statement, it's too late. And I'd like to try to see some wording that would not tie them down. And if you're talking about lawsuits, if the law says you've got to have that written statement on file that you don't have, then I think you do open yourself up more. If we've got a system that is working now where you can use other children's EpiPen to save another child's life, I think we need to change the wording, and I'm not sure how, but let's make it so that you don't have to have that written statement, but that you can use another child's medication to save a child's life.
Representative Clark, may I help you out a little bit on that
Yes,
one?
please.
Representative Harden, this is two portions of a bill. We passed a bill 2 years ago, okay? And in that section of that bill 2 years ago, we allowed students, if the doctor said they could self-administer and they gave them a prescription, okay, that they could bring their EpiPens to school, they could self-administer. But it didn't cover children that were, the doctor said, were too young to self-administer or for whatever reason were incapable of self-administering. So we're correcting that by adding that portion that requires a prescription to that, so that the school can keep it, the teachers can give that. The second portion of the bill is to give immunities, to let teachers know for sure that if they use an EpiPen in an emergency situation, if they've got a child that had no known allergies and all of a sudden they've got a child going into anaphylactic shock, if they have availability of an EpiPen, that they can use it and they will not be sued. Yes, it's two separate, yeah. It's two separate things we're trying to, so we're adding the younger children, like the current law, that even though they can't carry it to school because they can't self-administer, that the school can store it for them and that somebody can give it to them, and these teachers and administrators. It is. But thank you for your question. Who we got next? Who?
I think that Representative Cooper, may I speak?
Certainly.
I think that this would be a critical step in us ensuring that families and children do have a safe school environment. And for schools that do not, like larger school systems possibly that do not have protocols, I actually partnered with our public health state health director, and he gave protocols to Dawson County, Forsyth County, and Hall County. He offered it to every county in District Health 2, but not all counties chose to. You know, a lot of times people just don't understand the implementation. But I think that passing the legislation would actually give schools the urgency that they need to develop policies and to educate their staff for students that do have possible allergies, and we could prevent untimely deaths. It's all about the safety of our children.
Representative Byrd.
Going back to Representative Clark, what happens if a teacher does refuse at that time? Well, do we go and run down the hall to get another teacher?
I
mean,
yes,
is that solving that?
Yeah, yes. As I understand your question, yes, ma'am.
Thank you.
That teacher would not be forced. No.
Yeah, pardon? Representative Maddox. Representative Maddox, do you have a question? No, who we got? It's on.
Representative Clark, thank you for bringing this today. I think it's very important. One thing I didn't see in here on line 15 when it starts talking about storing prescriptions, you know, most all drugs has an expiration date. And we start storing prescriptions in there, and then we use something that's out of date and not effective. How are you going to address that we're using something on a child for the first time that was somebody else's prescriptions out of date?
Thank you, Representative Maddox. There is nothing mandating that they would have to. It only gives them the permission to store it on site for a child who may not have it. Maybe I should defer that question to the doctor.
Dr. Reddy. Dr.
Sure. The epinephrine auto-injectors, the expiration date is typically 12 to 24 months after it's bought from the drugstore. So if it's out of date and that's the only epinephrine you have, then certainly you should use it because it's probably going to have partial effectiveness. So it's certainly not going to hurt the person if all you have is an expired epinephrine. We send expired drugs to third world countries all the time in America that otherwise would be thrown in the trash because the reality is they're 90% effective and they're better than no drugs at all if you're in a third world country. So there's no danger in giving expired epinephrine, but certainly you raise an important point that there would be some responsibility and it would take a small amount of work on the part of the school nurse or some designated person at the school to make sure the stock epinephrine is up to date. It would take a checklist and it would require a little bit of work.
We do in most schools that we medications are stored and I think you can speak to the ones where there aren't nurses, but where there are nurses, we do have protocols in place for all medications. We check for recalls, we check expiration dates regularly. We lock up certain prescription medications, and we do have a responsibility, because we know most children in a big population, some amount of them are going to take a prescription maybe or an over-the-counter drug during the course of the school day. In a private school, we have permission to give certain over-the-counter medication that we get from the parent. And we also get permission from parents to give prescription medications if they're sick, if they have an EpiPen, if they have inhalers, things like that. So I think most schools and most teachers are used to there being some protocol in place for the meds to go with the kids when they go to field trips, when they go out to the playground, when they're off-site for any reason. So we do have safety checks in place in schools, and many teachers are familiar with EpiPens and have received EpiPen training because they have children who have prescription EpiPens in their class.
Okay. Thank you.
Can I speak to funding also, because I'm sure a lot of people have concerns about how much the EpiPens cost. They're less than $100. We have not had any problems funding these for all of our schools. For several years, 3 years in fact, some of the pharmaceuticals companies donated EpiPens for our schools, and they had a life expectancy of 1 year from the beginning of school to the end of the school year. Also, I've had PTOs purchase our stock EpiPens, United Way funding, and we've had personal parents, some physicians that have given us, the EpiPens for the school. So it's not been a problem for my school system in Dawson County.
Representative Dobbs.
Thank you, Madam Chairman. Representative Clark, since there's been testimony that some of these instances might be first-time occurrences, what is the danger in administering the drug to someone who is actually not suffering from this particular, I guess it's a medical situation, say, and they misdiagnose and possibly it's a seizure or who knows what? Is there a adverse effect of administering the drug when it's really not necessary?
Well, Representative Dobbs, it's an excellent question, one that I've discussed with the physician at great length, and the short answer is no, but I would give him an opportunity to answer that question.
Sure. The answer is no. There have been 0 case reports in the history of American literature and I believe international literature of intramuscular injected epinephrine or subcutaneous injected epinephrine actually causing any adverse health event in a child, and even in adults for that matter. There's no good, credible evidence that an intramuscular injection of epinephrine has ever harmed the person, regardless of whether or not they're in anaphylaxis or not. So that is not a concern. It's a popular misconception on some physicians' parts that there's a danger associated with intramuscular epinephrine, and the reason is because most physicians, their familiarity with epinephrine is the intravenous form of epinephrine, which is used in a totally different situation when somebody's actually having a bad heart attack and the heart is stopped and they're basically dead. And that's a different, that's a whole different ball game than we're dealing with here. So this is safe, and I have no concern about anybody who may be misidentified as having anaphylaxis getting epinephrine, and it's not going to hurt them.
Thank you very much.
Dr. Redding, we seem to have no further questions from the committee, but before I call the question, since you have been the person that has brought this to our attention and helped us move along in this, was there anything else that you would like to say to the committee before I call the vote?
Sure.
Just anything about the illness or the treatment or anything you would like to say?
Essentially, anaphylaxis is a systemic allergic reaction that quickly causes death. And death usually occurs within 30 minutes after exposure to either the yellow jacket or the honeybee or eating a food or, in some cases, taking a drug that the person has a reaction to. So because it occurs within 30 minutes, the important time period to treat it is quickly, within 5 or 10 minutes before the ambulance arrives, while of course calling 911 at the same time. But this is a medical problem that mainly occurs in the field, outside the hospital setting, outside the doctor's office setting, and it is essentially a life-saving first aid skill in giving epinephrine as opposed to a sophisticated medical diagnosis and treatment. It is actually a miracle, one of the few true miracle drugs that quickly reverses an event that could kill the person. I really can't think of any other health problem that there's a miracle drug that has such a low side effect potential that could save the person's life other than anaphylaxis. So the other important point I wanted to speak of is that this is essentially a proactive bill that we're trying to pass to be prepared, because it may not happen in the next 4 or 5 months, but I can say in the next couple of years there's a very good chance a student will have anaphylaxis and he may not have a prescription for EpiPen on file at the school, and it may be a severe reaction and he could die, and it could happen in the next couple of years, and we just want to prevent that death. This is not like DUI laws that save thousands of people's lives every year. We're not talking about numbers like that, but if it's your son or your grandson who is the person who dies, then that affects you just as much as if you were hit by a drunk driver. So in summary, that's what I'm trying to prevent that from happening.
Thank you. We had one more question pop up. Representative Drenner.
Thank you, Madam Chair. And Representative Clark, you've done a really good job. This is a tough committee, and I don't want to belabor the point, but I do have 2 follow-up questions, if you don't mind. First of all, in the bill, it does not mention any disposal procedures for expired pens. And have you considered what you're going to do with the disposal cost associated with that? Because this would not be able to go into the regular trash. And the second question is, I really don't understand why the Good Samaritan law would not come into play here.
Thank you for your questions, Representative Drenner. In regards to your first question on disposing, I hadn't thought about that one. Didn't ask that question. So, excellent question. I'm sure that
an ambulance would be called if an EpiPen is administered, and the EMTs would dispose of it in an impervious container. All schools have these containers because we have students, with diabetes. So often we use, medical supplies that the schools order for the clinics, and sometimes we just use like a Clorox container to dispose of these.
But what I'm talking about specifically is that if you're rotating out stock that's been expired, what provisions have you included in this where you're going to dispose of the pens that have already been expired?
The EpiPens in our school, actually, when they do become, a lot of times when the expiration date occurs, we return those to the pharmacists, and a lot of times they'll just give us another EpiPen to replace that. And sometimes, if they tell us to go ahead and discharge it, then the nurse is responsible, or there would be a protocol in place for medication to be, exposed of. And that medication, actually, I've discharged of it myself before, and just, taken the EpiPen and placed it in the sink at school and discharged the medication and then put it in the impervious container. So each school would have to develop their own policy, but it would not be an expense to the school.
Thank you.
Dr. Ray.
Thank you, Jenny. In response to your the Good Samaritan law. Well, in my opinion, in response to your question there, is that it's not, while it is clearly laid out in that bill that was passed a couple years ago, that a child had permission to carry an EpiPen if the doctor deemed the child was capable. It did not, obviously this is inserting this section into that code right there to be sure that we specify for that child who does not have the EpiPen, who is Representative, I always want Buddy, Hanson, sorry, Hardin, I apologize. As Hardin pointed out, that half these children of the deaths that occurred at Bee Sting happen on the first occurrence. So there was nothing in state law to give teachers that piece, that freedom that they could step in. So I would agree with you that the Good Samaritan law so far in many cases has given some freedom for that teacher to do that, but it's never been spelled out Whereas it has been spelled out. It seems to be lacking because it is spelled out what happens with that child who there's a already known occurrence of allergic reaction. So
Okay.
I think it's worth it for those cases where a life could be saved, in my opinion.
Representative Drenner, if I may add to that, since I've learned an awful lot about this, in the last few weeks, our Good Samaritan law might cover it, and it probably would. But the school districts seem to like everything tied up like a little dog's dinner, as they say. And in that area of the code where it deals with this, it does not speak to this immunity. And so by putting it into the area of the law that talks about a child being able to carry their EpiPens, or the school to store it for the children who have known allergic reactions, but the school has to give it, and then to take care of this emergency situation, it isn't spelled out. So this is to clearly spell it out to school districts that they are to let their teachers know that in emergency situations they are allowed to do this, or they are allowed to administer the EpiPen to students who are unable to administer it to themselves. So it is just making it extremely clear so that you do not have a situation where you have the first symptoms occur, the 10 minutes are usually blotches, whelps on the skin, maybe the lips tingle and swell, and so you lose about 10 minutes that you might know a child is having a reaction. Then you've got 20 minutes before a child can be dead, and you're looking for an EpiPen in that time, and we just don't want any teacher or administrator to sit there and have to think and say in that time period, okay, if I do this, will I get sued? Should I do this? Should I not? That they know they have the immunity to act in an emergency situation in the best interest of the child. Okay, we got another question. Reiners, Representative Reiners.
Thank you so much, Madam Chair. And I really appreciate the sponsor bringing this bill forward to the committee. And just some things you might want to think about as we move forward to the Senate. And then I want to ask you a couple questions or two. With all due respect to the expiration date question, I think we just had a situation in Georgia where we were in front of the Supreme Court because our drugs didn't have an expiration date when we were trying to put someone to death. So unfortunately, things slipped through the cracks. So just something there that might put into a procedural on how you do dispose of it instead of, well, lots of them do it this way. Because I would hate the unintended consequences if someone doesn't, then they could get sued and perhaps they don't have that liability. So maybe just cleaning it up a little bit in that regard. Additionally, I want to just ask you your opinions and thoughts, as I'm married to a teacher, about perhaps a paraprofessional.
What?
Or a para. How about a substitute teacher?
As I understand, in reading this, that would cover all personnel at the school.
No, I don't. With all due respect, I don't think you. There's nothing wrong with accepting a friendly amendment. So when you get to the Senate, the burden of communication always lies with the author. I'd hate for you're trying to get immunity here. I'd hate for someone to go, but you didn't train you this or you didn't train you that. A substitute teacher, perhaps, or a paraprofessional. I'm just. That's your call to make, obviously. And let me ask you this: is a school system liable if they didn't train their teacher?
In my opinion, no.
And what do you base that on?
And what I base that on is working with the attorney and drawing this up and making sure that we weren't mandating that requirement on the teachers.
I'd like to ask you all what you think about the substitute teachers and the paraprofessionals.
My school system, I train our substitutes, and we also have a system in place at my school where, there's on each desk there's a folder for the substitute teacher. They know all the kids that have prescribed, EpiPens, and also,
do you think they should get the immunity?
Trained.
You think they should get the immunity?
Absolutely, yes. In the school setting, if the Epi is administered in the school setting for life-saving, need for anaphylaxis, I do think that they should not be liable.
Thank you, Madam Chairwoman. Thank you.
Okay. Representative Fullerton.
Thank you. Thank you, Madam Chairman. You said a minute ago
Dr. Redding.
the nurse.
Oh, so sorry.
That your school system paid for it, could pay for it and could afford it.
My school system has not paid for the epinephrine. We have always had funding. Like I said, pharmaceutical companies have donated the EpiPens. And also, I have received United Way funding. PTO has paid for it. So it's never been from the school budget. It's always been from an outside source. But I've not had a problem, finding the money to pay for the EpiPens. In fact, just this year, I actually am using generic EpiPens that are lots less expensive, and I think they're $60 per pen.
Gosh, I was just thinking, I'm from Albany, and we have some school systems that they're less well off than some in North Georgia.
We're talking about in numbers like maybe 2 EpiPens. If you have a really large school, more than 2,000 kids, 1,000 to 2,000, maybe you have 3 EpiPens.
Okay.
Thank you. $60 about a piece. So we do a PTA or the parents group. We would petition them before we would put it on our budget.
Okay.
May I interject here? One thing that we're careful about in this bill is not to require that schools have to stock EpiPens. So the only thing that this bill, as I understand here, is to say that there's nothing to prevent a school from stockpiling an EpiPen, but there is no requirement. They have immunity to administer an EpiPen if they can find one, get one in their possession, and it would certainly probably be wise to stockpile it, but didn't feel like that we should mandate that.
Okay, are we about to get Representative Henson?
Thank you. I think I heard something you said earlier, and I just heard it again. I had an EpiPen. I think I got 2 of them at a point when I was having an allergic reaction to aspirin, and never used them. But if I remember, I paid $10, $12 for the 2 of them, and you're saying they cost $60. I'm very confused. Thank you. You know something, you're probably right. I didn't realize they were at that high a cost. Thank you very much.
Okay, Representative Chokas, you're recognized for a motion.
Thank you, Madam Chair. At this time, I'd like to move that Committee Substitute House Bill 277, which is LC 334022S, receive the due pass recommendation from our committee.
Okay, we've got a motion and a second, and I missed one person. I have to hold it there for a second. I missed one person that wants to speak. Bill Clark.
Thank you, Madam Chair, and thank you for asking me to speak. I'm Bill Clark on behalf of the Georgia Trial Lawyers Association. I want to clear up some of the concerns that you have. They're legitimate concerns, but I believe I can solve the problem for you. This is a good bill. This is a bill that we support, very similar to the way we supported a number of years ago the bill that gave immunity for those who would use AEDs, automatic external defibrillators. Everybody was concerned somebody could get shocked if you use one of these. They don't harm people at all. They are life-saving. So are EpiPens. And so we support this bill as an appropriate balance of duties and immunities for the school system, for the teachers, for those who would be trying to simply save a child's life. So we see this as very similar to the AED legislation that we were glad to work with a number of you on a number of years ago. And I'll tell you, though, these folks are already immune under what's called qualified immunity as an employee or otherwise somebody working for the school system. But this bill puts it in the education code where lawyers who represent school districts and represent teachers commonly go to look for what are our folks' duties and responsibilities. They don't have to go look over in the tort code or over in some other. They look at Title 20 where all of their education law that they usually look for is. And so it makes great sense to put, some would call it belts and suspenders, I would call it the second belt, and it's a belt that lawyers representing your school districts are used to looking for. and that would happen if you put it in this code. So we stand in support of the bill and appreciate Representative Clark, and hope this Representative Clark will help me, Bill Clark, be supportive of this bill. And I'm glad to answer any questions, but appreciate the chair asking us to speak.
Representative Clark, I have a question. Do you see any problem, or would they, as this bill moves forward and a chance where it could include parapros and substitute teachers, do you see any problem with that? Would they still be covered in the same area? No, I'm asking you, Bill.
All that I've just said would apply to them as well. So they're already covered, but you certainly should include them, could include them, and it would be helpful the same way that this goes in the law. And now that I think about it, if you only list, there's a legal principle, if you only include 3 people and you really meant it to also include others, a court's going to look at that and say the only 3 you're immunizing are these 3, teachers, administrators, and whoever the third one was in here. So adding the others probably would be an appropriate addition to the bill.
Okay. Thank you.
Thank you,
Any
Madam
other
Chair.
questions for Mr. Clark? Okay. All right. We have a motion and a second. We're open up for discussions or... Representative Reinders.
Thank you, Madam Chair. At the appropriate time to show legislative intent, I would like to add a friendly amendment.
Okay. I think this is the appropriate time. What?
All right. Thank you, Madam Chairman, members of the committee. Line 41, Ms. Betsy. Okay. After the word teacher, comma, substitute teacher, comma, paraprofessional, comma, and then pick back up with school administrator or school nurse.
How about bus drivers?
Who's saying that?
You need to add that.
Probably speaking out of turn, but we had. Yes.
And other school system employees.
Or just. Excuse me, Betsy. Betsy is our attorney for the people who don't know.
We could add some general language and still retain the teachers, school administrators, and school nurses, say other appropriate school personnel as determined by the local board. Something let them determine who they think, needs it, providing that training.
What?
But not,
right, Representative Collins.
But not on the immunity clause. You wouldn't want local boards to determine who's going to be immunity.
That's right.
If you're going to add it specifically, you'd need to add. I think couldn't you add just that was and then say other school employees, period.
Well, I'd like to ask the attorney that was up there. Was there another Mr. Clark?
Yeah. Bill Clark.
Yeah, Mr. Clark. Our thought process is exactly the same. If we look at things like water in Lake Lanier and it says because you didn't say for drinking, then you can't use it. So that's why I want to show legislative intent here. But I've also understand, and I'm not an attorney, that if you make the language sometimes so broad, it may show the legislative intent, but it may also show that it wasn't deemed serious use, trying to cover everybody, and that can be dangerous too.
I agree with everything you just said. And I think Legislative Council's suggestion might be to add other appropriate school personnel. Does 2 things. It limits it to school personnel. It's not just Joe off the street who happens to be in school at the time. But it also is a feature of local control. Let the local board decide which one of these folks you want to have do this. And if you use that language in line somewhere in subparagraph D, I think that accomplishes your goal.
Madam Chair,
yes.
I just realized that I didn't write my amendment out like I wanted it. And
okay. Well, gee, you made a mistake.
I did.
Reinders. That doesn't happen often.
I did.
Okay? You got it correct now?
Would you allow me to correct it? I couldn't read my own writing a minute ago. My amendment would be on line 41, a teacher / or comma, substitute teacher, comma, paraprofessional, comma, school administrator, comma, and any locally approved.
No.
No?
No, school nurse.
School nurse.
And other appropriate school personnel.
Yeah, that's what I had written.
Okay. Betsy, would you like to comment on that?
Yeah, I'm actually now speaking this out. I'm wondering if it would just, if we're trying to overcomplicate it and under Bill's point about including some and not others. I mean, if we just say
Representative Collins?
Can I have some of that?
Yeah.
There's a part of me that says any school personnel as deemed appropriate could, in fact, if the school doesn't make that determination, could, in fact, inadvertently exclude a nurse who was trying to do the right thing because the school board never met on it. I think if we show some of it, and I need help from a lawyer again, if we show some of it, then they know they have to.
Well, those two things are not necessarily tied together. That subsection D, if we say any school personnel who would get paid to administer, it doesn't mean that they had to be designated necessarily. Those aren't tied together. The immunity doesn't follow whether or not they receive that training or that specific information. So, I don't know, Bill, you want to comment?
Representative Clark. Bill Clark.
She meant to apologize to you. Assure you.
We'll let you be. You're helping the legislative process. We'll give you a temporary.
I'm always trying to help in the legislative process, Madam Chair.
Well, I'd like the members of the audience to realize that Bill Clark and I are on really good terms in agreeing on something for a change. It's not often that we do that with the trial lawyers, is it, Bill?
Well,
occasionally.
not as often as we would like to.
Not that. So.
Oh, he's good.
I think Legislative Counsel has given you a good suggestion that covers it broadly enough, but appropriately narrows it. A court looking at the language she suggested, I think, will get exactly what the committee meant to do, which was to include the right folks. And, that's obviously very generally speaking, but her language leads a court to only that conclusion, that it's the right folks. It's not Joe off the street who happened to be in the building at the time. It's somebody who's employed employed by the school district.
Okay. Representative Reinders, is it okay if Betsy reads correctly your
Yeah, I wrote it down, and she can reread it for me.
Okay.
All right, so authorizing school personnel to administer auto-injectable epinephrine.
Yes.
And then down on line 41, it would say any school personnel who in good faith administers epinephrine to students.
Okay.
That's what I had, Madam Chair.
Okay, we have an amendment, the Reinders amendment, the Betsy Reinders amendment, and we have a motion.
That scares me.
And we have a motion and a second. Everyone in favor of the Betsy Reinders amendment, say aye.
Aye.
Anyone opposed, no. Okay, it passes. Now we are back to the bill, and we have a motion and a second. Is there any further discussion on the bill? Who do I have? Oh, Representative Drenner.
Madam Chair, I would like to speak to Chairman Reinders.
Go ahead,
I would feel most comfortable if we would add something that would include the disposal procedures. And I don't know if you want to do this here or if you just want the author to carry that forward into the Senate. But from my concern is that just squirting it down the drain is not appropriate.
Representative Drenner, will you be okay if you and the author, and as its bill moves forward, and you look at the bill before? I asked Betsy to bring me, and I have a copy of the bill that is on the books now, and she thought that the bill was general enough about the schools developing policies that it would cover that and that they would develop it without us being very specific. Will it be okay if you review the old bill and then discuss it with Representative Clark as it moves forward? Would that be agreeable?
Yes, that would be great. Thank you, Madam Chair.
Thank you. Y'all pass this down. Okay. So any other further discussion on the bill? Okay, we have a motion and a second. Everyone in favor of the substitute to House Bill 227 as amended, say aye.
Aye.
Anyone opposed, no. The ayes have it. It is passed. Thank you very much, the committee. Thank you very much, everyone.